thank you all very much for coming to this second in the, I'm not able to see the mute feature. Melissa, I believe you are unmuted. If you want to try to say something, let me know. If you are having trouble communicating, go ahead and use the chat feature. But at any rate, thank you all for coming back. Now it looks like I'm not able to hear you. I don't actually see you either, Melissa. Okay, at any rate, thank you guys so much for coming. Today we're going to be talking about language access specifically during crisis situations, which I know is really important to everybody at this particular moment in time, because I think that people are feeling really intimidated and having a lot of trouble making sure that they're getting accurate information to their English learning communities in a timely fashion. So we're going to go ahead and work on this worksheet that I sent you. It's very basic and simple, but I think it's a really good exercise to get yourself organized so that after this webinar, you can go ahead and just execute everything. So it doesn't have to be neat and tidy. It doesn't have to be typed or official. You can always go back and edit it. This worksheet is just intended to get you organized so that you can execute the things we talk about today quickly and efficiently as soon as possible. So timely and accurate communication is absolutely one of the most important parts of sort of any crisis management situation. But what if information is only available in a language that you can't understand? So in the case of COVID-19, everybody needs to know what should be done to prepare and protect ourselves and our families from being exposed or from exposing others. Misinformation needs to be combated. There's a lot of myths and rumors out there, and there are complicating cultural and literacy factors that also need to be considered. And all this while information is constantly and rapidly changing, and in a lot of cases within power structures that lack any kind of language access policies, procedures, or leadership. So social workers, government agencies, advocates might be distributing leaflets or helpful information, but in most cases it's in English, or it might be poorly translated by what we call citizen translators. And you'll hear me use that term a lot. Citizen translators are bilingual volunteers and maybe staff members or community members who want to help, and so they offer their language services to translate, but they don't have any real formal training with translation. So we'll talk a little bit about making sure that those people are trained later in this presentation. But for now, you know, we have to watch out because that's one of the ways that English learners can become alienated from information. Or the information might already become obsolete by the time it reaches English learners. So if you lump all of these factors together, all of these complications, it's sort of like a big nebulous problem that we can just call multilingual communication in a crisis is really hard. Right? Even if you have a lot of experience with language access, it's intimidating to make sure you get it right when the stakes are high like this. So this workshop is going to sort of attempt to unlump all of these problems and create clear and manageable solutions to each one of them so that you can develop a strategy to deploy effective and accurate and rapid language services to your English learning communities with regard to COVID-19. So we're going to use this discussion to complete that worksheet that I emailed you this morning, and we're going to talk about identifying your information sources, your target audiences, and what we're going to call critical communicators. We're going to talk about engaging citizen translators, professional freelancers, and language service providers. We're going to talk about your communication channels and mediums, as well as cultural and ethical and practical considerations. So we're going to pull all those things together to kind of list a step-by-step strategy or approach to streamlining your information from limited sources through people who have direct contact with communities and in a feedback loop with those communities to make sure that you're getting input from them. During this presentation, I'm going to use the term crisis translation to refer to any sort of cross-language mediation that happens in any stage of a crisis. Translation, in this case, is used sort of as an umbrella term for translating and interpreting, even though translation and interpretation are separate tasks in the professional sphere and two separate disciplines. So if you haven't already done so, please either open your editable language access crisis response worksheet or pull it out to write on it, and we'll work on it together during about the next 40 minutes. And then we'll have some time for questions and answers. And I'll do my best to keep up with questions and comments that you put in the chat feature as well. Feel free to interrupt me, yell out if you have questions. I'm happy to answer them. So we're not gonna get to work through all of this worksheet together, like in a super thorough way. So when I'm asking you to fill it out, I want you to just brainstorm, right? Just brain dump anything that comes into your head. And then after this session, you're welcome to hop on one of my individual coaching sessions and I can help you refine it, or you can refine it together with your teams or with yourself to sort of tailor it to your own organization. It's sort of a guide, but not, you know, the end all and be all. And so of course you can adapt it. Of course, there's no one umbrella solution that's going to be applicable across all of the different sorts of members and people that we have here today. So move through the content with your own answers. Maybe if you feel like sharing something, if you have insights to add to the conversation, please go ahead and do that. I'm going to start with some policy recommendations that I sourced from this really great organization called the International Crisis Translation Network. And I kind of want you to keep these in the back of your mind as we move through the exercises and the information. So, you know, within your organization, some of you may and some of you may not already have language access plans, and that's okay. I think after this experience, all of us are thinking more about emergency planning and about having policies and procedures in place, and that's a good thing. So this is going to be kind of trial by fire, where you're just jumping in with different degrees of experience and preparedness. But I think wherever you're starting from, it's important that within your organization, you specify basically a language access coordinator or a person who is responsible for executing any kind of plan that you have to deploy rapid crisis translation and interpretation services. You want to make sure that you have contracts in place, even if you're using community volunteers or you have your own translators. Make sure that it is clear to the people in your organization who they should call or who they can call if they need written translation, if they need oral interpretation, if they need ASL interpretation, if they need telephonic interpretation, or if they need video remote interpretation, right? Because these are all separate services, and so you might have to have a contract in place with more than one provider. But get that out of the way and make sure that you clarify any kind of rush fees that these providers are going to charge you, because a lot of the time, if you're trying to get press releases or information out by the next day, they're going to triple, quadruple the prices on you. So try to negotiate something that's not that into your contracts. And obviously, you know, deployment is more important than the minutia. So start translating. But as you're moving through all of the other crazy things that we're all dealing with right now, maybe initiate some of those contracts, reach out, start building relationships with language service providers. Make sure that emergency management communication translation covers like sort of all phases of crisis and disaster management. So it's not just getting current health and safety information to people. It's talking about mitigation in the future, preparedness in the future, response, and also into recovery. And And remember that languages spoken by affected communities, including American Sign Language or sign language, different levels of literacy and cultural appropriateness should always be considered, right? So you're not just going to translate things into Spanish and send them out into Central American communities that speak indigenous languages and Spanish is a second language, right? That's an example of taking some time to get to know your audience. You want to make sure that emergency responders and professional associations of translators and interpreters have access to each other because you're going to be streamlining information, but if something goes wrong, you don't want to have to be a middleman, right? You want public safety officials, first responders to be able to reach out to interpreters on their own. Training is really important. You want to make sure that you are providing professional training to any volunteer translators and interpreters that you have so that they can effectively translate and interpret. That becomes really important because as well-meaning as citizen translators are, they don't always have the skills or the ethical understanding that a trained professional would. So it's okay to use those people, just make sure that you give them some training. And I did send you all a really great training guide that was published by this great association for crisis translation. And I hope that it can be useful to all of you. And finally, emergency management communication policies should include provision for translation and interpreting and be regularly reviewed. So that's sort of more in like the emergency preparedness realm that I think all of us are going to be more diligent about once this crisis is over. So information about COVID-19 is everywhere all the time, but lots of it's inaccurate or outdated. There are a lot of rumors and myths like we talked about earlier. The World Health Organization has actually gone so far as to call false information around the pandemic an infodemic. And they define this as an overabundance of information, some accurate and some not, that makes it hard for people to find trustworthy sources and reliable guidance when they need it. So in our own communities, it's important to keep an ear to the ground to try to identify and respond to these myths and rumors about COVID-19 as a first step in an ongoing effort. So we'll talk later about identifying these critical communicators or individuals within English learning communities, such as advocates, religious or tribal leaders, community association leaders, who can help you monitor those rumors and the information circulating in communities in order to be more responsive and strategic about targeting your communications. But before we can initiate any effective communication response, it's really important to identify the sources of information that you're going to be sharing. So on your worksheets, if you don't mind, please fill out on page 1, or I'm sorry, on page 2, information sources. I want you to just brainstorm in that first table there, all of the different places that you're getting your information from right now, because I think a lot of the times what happens is, you know, all the different stakeholders in a community find great information and infographics and things that they want to share with communities. And so they kind of piecemeal a response or, you know, some organizations are translating things that they think are important while other organizations are translating things that they think are important. And then the result of that is, again, that oversaturation of information. So go ahead and just take maybe 2 or 3 minutes and fill in this first table here. And these can be things like health departments, the World Health Organization, Centers for Disease Control, local healthcare providers. Like I know in one Spanish-speaking community in my city, in Pittsburgh, there's a pediatrician who's sort of like the community's go-to for information, and he's really great. So I would list him in this section. You know, private medical practitioners, social media pages, news outlets, you know, just a brain dump of all sorts of potential sources of information. anybody want to share with the group some of their ideas? Or I'll rephrase that to say it would be awesome if somebody could share with the group some of your ideas. I'm unmuting everybody.
Hi, this is Karen. Can you hear me?
I can.
Okay. I just started making a list of some of the different sources of information that I've been using. So CDC, Refugee Council USA or RC USA. We've had a lot of questions coming in around business services. So our Small Business Administration of Michigan, the Small Business Administration for the feds, our Michigan Economic Development Corporation, our state's unemployment insurance agency information, New American Economy we've been using for economic impact data around impact of immigrants and refugees in terms of how many healthcare workers, ag workers, et cetera. And then really, I mean, primarily, and it's because of what I've been doing almost daily in terms of our state's translations as our own state website. I mean, that's where I've been getting the majority of my information because that's really I spend most of my time looking at that information. So that's just kind of an example of some of the ones that we've used.
That's great. Anybody else have some good ones?
Yeah, one of the things that I found was really useful is the British Red Cross, in conjunction with Doctors of the World, has, the last time I checked, information in about 45, 46 languages.
Can you say that again? You're a little bit hard to hear.
Okay. One of the things that I found useful on coronavirus was the British Red Cross and Doctors of the World. They had information, available in over 40 languages.
Great.
And some really good graphics.
Great. Yeah, and graphics are really going to be important when you take literacy into account. A big one here in Pittsburgh is our county's Department of Human Services. They do daily blotters and updates.
This is Brittany from Toledo. I have definitely been feeling myself the information fatigue. So I've already been kind of trying to limit my sources, and I've been keeping it to our local health department. Those are the documents the documents they issue are the ones that we try to translate. But occasionally, if there's gaps, we do share some of the information from like the Welcoming America Network. And there's also a municipal language access network or a language access municipal network for cities that are doing language access, and that they share a lot of resources as well. And it's some of the bigger cities that aren't in the Welcoming America Network, like Boston and et cetera. So
great. Yeah, so information fatigue is exactly the right word to describe, like even just in this short little exercise, it's a good example of how people are kind of ad hoc pulling information that looks great from a bunch of different sources. And even if it's not conflicting information, it's a lot of information. And what you want for communities who might be a little bit more vulnerable to misinformation or information fatigue or just being marginalized in general is to keep things very simple and very short, right? And the more you can narrow down your sources of information, the better. So now I'm going to ask you guys to choose 2 primary sources of information that you feel would be good and sufficient to source information from that you would then translate and pass on to your English learning communities. So in my case, it would be for example, the Centers for Disease Control and our county's health department. That's it.
But the risk to that is, if you don't mind me asking a question.
Not at all.
Okay, so to me, the risk to that is we all don't necessarily have the capacity to translate everything ourselves. So I think that's partly why I think we're sourcing, because yes, that makes sense inherently. If I was translating or, you know, had the control to get every single document translated, I would just use those two sources. But since my capacity or our capacity is limited, that's why I've been kind of borrowing things from other communities.
Sure, yeah, and actually that's one of the things that this workshop is designed to talk about, is how to get these things translated at a very low cost or at no cost quickly, right? So this is a strategy kind of session to talk about how to get that done. And of course, you know, in a perfect world, we'd have a straight line between information source and target audience, but reality is a little bit bumpier than that. And so of course, there are going to be great graphics that you can borrow from other places, and that's good. But you also want to make sure that you have a strategy to getting things translated as quickly as possible into your top languages as it changes on a regular basis. And we're going to talk about doing that actually in just a few minutes. So for now, just for the sake of, let's pretend everything's in a perfect world and you don't have to worry about cost or speed or anything like that. And let's just get these sources down on paper. So I've chosen my county health department and the Centers for Disease Control. And the next step is sort of identifying the person or persons at those sources who you would contact. And then you don't have to do it right now, obviously, because we're on the phone. And then just going ahead and dumping their email and phone number in here too. So, for example, at Pittsburgh, in the Allegheny County Health Department, there's an intern who every day fires off updates at about 9 a.m. And so we have kind of a deal with them where they send it to us at about 7:30, 8 a.m. so that we can have it translated by the end of the day and still stay current. And we'll talk about strategies like that later, but I'm gonna write down that intern's name. And after this webinar, I'm gonna go ahead and put his email address and his phone number in there. And within the CDC, that's one of those sites where you're just verifying information or pulling those graphics from. I know they have a lot of stuff in Spanish, some stuff in other languages. It's not the best for sourcing information, but it is a good site for verifying current information. So those would be my two choices for now, just to help me narrow down my source. So by narrowing it down, you know, the purpose of this exercise is not to create your whole language access policy, your whole response strategy in one 1-hour section. But what we do want to do is to start to think about that flood of information coming from so many different sources and consider how facts can become obscured in this scenario and sort of balance that against the extra work you may have to put in to get things translated, et cetera, et cetera. So think about how you have to be reactionary to choose information from all of these different options to be translated. Think about how the sources might be biased, hyperbolic, or incomplete, or even poorly translated, right? So when you're pulling things from the open internet, you never know where they're coming from. Even with good intentions, some things can be wrong. So in and of itself, going through this sort of mental sorting exercise and deciding which information to share with English learning communities is totally overwhelming. So now that you've kind of recorded your two sources, when you're coordinating your language access responses and procedures, try to stay as close as possible to only using these two sources, right? with the caveat that, you know, obviously in the real world, you're going to need to pull some information from elsewhere. But the idea here is to create a workflow in which you're going to have partnerships and dedicated folks who are willing to be a part of a team to get this done together. And this is going to streamline things a lot. It's going to remove a lot of the time and the pressure from your response. So once you've identified that person or maybe a publication from each of your sources and, you know, you're confident about it, try to coordinate or plan daily exchanges or extractions of information. So like I was talking about in my example, whoever is responsible for publishing daily statistics within your county's health departments, make contact with that person, have a plan, have them add you to a mailer, ask them if you can have access to it before it goes public so you can get a head start on translating. And usually these are just daily updates of how many new cases, how many deaths, you know, where they're located, helpful information. So they're going to be fairly short. And if you have good translation partners, you should be able to get them done free or at barely a charge every day and just kind of add that to your daily workflow. Now, I think of, Brittany, to address your other question, there's information that's universal, right? Like there are worksheets and there are posters about how to wash your hands properly. There are infographics about social distancing and how to use masks, et cetera, et cetera. Those are good examples of things you can pull from the internet and keep on file because they don't change very much, right? It's really getting the critical health and safety information that's coming from your state, your county, your local governments out and into the hands of people who need it on a regular basis, accurately and quickly. So let's see here. Once you've kind of made contact with that person, check in with them, you know, every morning, put it on your to-do list, ping them, say, hey, do you have an update for me yet? And the earlier in the day you can obtain that information, the sooner you can get it translated and distributed. So on your worksheet, hopefully you will be able to list this information and refer back to it when you need it. A good source that is updated somewhat regularly is the World Health Organization situation reports. There's some good ones out there. Just make sure that you narrow it down to a few. And before we move on, I also want to make the point to sort of reinforce here that no person who is affected by disaster should be discriminated against on the basis of language or national origin. English learning communities are entitled to the same quantity and quality of information in a crisis as any other affected population. So information accessibility for many people might mean translation from one language into another in varying modes and formats, depending on levels of literacy, context, time constraints, staffing issues, and access to information in a crisis is a fundamental right. So it's hard, right, to create these daily workflows, but it's really important to keep people informed and to keep all of our communities healthier. Information access reduces vulnerability, it enhances resilience, and I think everybody on this call agrees that it's the right thing to do. So this is about safety as much as it is about social justice, and it's an issue that reflects our country's civil rights legislation, and it should be treated as urgent, meaningful, and equitable by everyone involved. So identifying your target audiences is going to be the next step, and this one can be a little bit tricky because I think a lot of the people in this workshop a lot of the people in this workshop already kind of have a picture in their minds about what the breakdown is in their respective communities. So for example, in my mind, the picture looks like a bunch of spaghetti thrown onto a plate, which represents Pittsburgh's road systems and hills and topography, which is just crazy and it's a mess. And then it's intersected by three sides of a triangle where the rivers meet downtown. And there's sort of like a patchwork of shaded areas in my brain covering the spaghetti monster. And those shaded areas represent clusters of immigrants and refugees that I just sort of know about from working with them, right? But it's not data backed, right? It's just my own personal experience. It's my own anecdote. So like, for example, we have Spanish speakers on our East End. We have Nepali speakers in our southern suburbs. We have Somali Bantu families in the north side. But, you know, how old is this data? Does it reflect current demographics? Does it reflect actual, you know, good census information? Does it get granular enough in terms of the breakdown? So that's to say, are the Spanish speakers in the East End, you know, are they those Central Americans who maybe speak indigenous languages, or is Spanish their primary language? What are the median age? How would these factors affect literacy levels? What are the most current population statistics? You know, how quickly is this community growing or shrinking? And who are the people, right? What is their level of trust when it comes to outsiders and outside information, law enforcement, public safety? Where do they work? Where do they play? Where do they learn, right? And by getting to know people and the people we're trying to reach, we, you know, kind of talked about this briefly in our first workshop, the idea that even advocates have undetected biases, right? And we tend to think of English learning communities as deficient in some way, or needy or vulnerable, and as needing to be, quote, saved or helped, when really they are capable adults who just need equity and they need access. So taking the time to check that our perceptions match with the reality is an important part of outreach, right? And I know this is on an extremely accelerated timeline, and that's really hard. But, you know, I would just say, don't push yourselves to write a thesis on each community represented in your region, but just jotting down some identifying information about English learning communities on your worksheets is something that you can do on your own, or we can do together right now to get kind of a head start on retraining our brains to approach communication and outreach from a place of greater respect. So let's also take a few minutes to identify community centers, libraries, associations, advocacy organizations, religious centers, individuals who are trusted by these communities or embedded in these communities on part 3 of your worksheet. And again, these are just real quick brain dumps. So for example, there's a great organization in our biggest Latinx community called Casa San Jose, and I would list them as, you know, people who would be important embedded individuals and organizations.
Mary Jane?
Yes.
This is Karen. I've got a question around, you know, identifying top languages spoken. Who do those languages represent?
Sure.
Not as much the geographic piece, because that's, I think, pretty easy to figure out. But so, like, when I actually looked, like at the Migration Policy Institute data profile for Michigan to look at the top languages spoken, or the top 10 languages spoken, based on the data they have. And when I look at that, the number 4 language is German. Well, I can tell you, German is not a language we necessarily need to translate information into, because that's not going to be helpful for populations in general. I don't hear often about people having the need for something translated into German, right? So how do you, when you're going through and selecting those languages, how is the best way to determine what languages you use? So like you said, it's like we're doing Spanish here in Michigan, but we're not doing any subsequent dialects. We're just doing Spanish. So is there a method that anyone, I guess, on the phone or Mary Jane, that you would recommend in terms of identifying how you translate?
Well, Karen, you're probably not doing Spanish. You're probably either
right
or
right.
Latin America. I think
yes.
My translating company identifies that either you can use US Spanish or Latin American Spanish, I think. So, and I think we have identified US Spanish based on talking to our partners, but I don't know if that you know, that wouldn't be very global at the same time for our community either.
Well, but I'm just even saying, like, how do you, I know this is a big question, but like, how do you determine which languages you should be looking at? Because I guess my point is, I don't think you should be basing it just on numbers. Because like I said, if we're basing it on numbers, our number 4 top language spoken in Michigan is German. And again, I don't think we need German. So
we have that in our top 10 in Ohio too. And I'm like, I don't even know who is German limited English, you know, like maybe they exist, but.
Well, this is a really good question. Because yeah, like how do you determine that number, right? Is it data-based? Is it anecdotal? And I think the answer, especially in a crisis situation, is that it's a little bit of both, but mostly anecdotal. So you know your community pretty well, right? You want to take those imaginary clusters of people that you know, right? Like I know that our Nepali population lives in the south. I know that most of our Somali Bantu populations live in the north side. And then dig down a little deeper and say, okay, well, who are the Somali Bantus? What languages do they speak, right? In our case, it's Kinyarwanda, well, the Rwandans speak Kinyarwanda, but we have a lot of Kizigua, Mai, and then they speak Swahili. But most of them came here via refugee camps in Kenya, so the Swahili they speak is actually a second language for them, right? So just kind of getting to know facts like that and saying, well, okay, we would put Swahili on that list, but we would also put, Kizigua on that list because I know that this community exists, even if it's not reflected in the data. Because also keep in mind that the census data is 10 years old, and even the American survey is not updated as often as it should be, right? So I would say go with your gut, you know your community, and then kind of do a little bit of a deeper dive into who the people are. Does that make sense?
Yes.
Do you know why because the American Community Survey does get updated more regularly. It's just the limited English proficient numbers haven't been updated that I can see since 14. Do you know why that is?
Well, they're what you call a hard to reach population, and they're limited resources, and unfortunately they're just not prioritized, I think, except for by community advocates who are deliberate about it. And that's a problem. It's a real problem that we have to address. And unfortunately, given the timing of COVID-19 with this year's census, I don't think that situation is going to improve much. So that's sort of a whole nother part of language access that I think is going to become more imperative as we move into the next 5 years.
Well, yeah, because it's more and more and more updated. So.
Absolutely. Yeah.
Okay.
So I'm skipping past the first part of part 3. I do recommend that you do the exercise just to organize things in your brain. But the next page, listing the language groups, the neighborhoods they live in, and then the embedded individuals and organizations. Those are who are going to be your information disseminators. So it's really important to do a deep dive into that, right? So I mentioned Casa San Jose. We also have several libraries that have free English classes that are very popular. We also have, there's a group called Open Field that does soccer in the community with a lot of the African communities. There's a refugee summer camp called Arise, right? These are all trusted community partners who you can build deliberate partnerships with to have them distribute the information that you are having translated or that you're gathering from your sources. So we don't have a whole super big ton of time left. So I guess for this exercise, go ahead and do it after, we finish. But the big important thing is going to be on the next page. Once you've identified those organizations, and gone through the exercise, you want to go ahead and identify who the contact person is there that you can build a relationship with. And again, we're in a crisis. This isn't the best time to be, carefully initiating relationships. There's not time for that. But even if you just reach out to people and say, hey, we are trying to limit misinformation and streamline data from the county to get translated information into the hands of your community, will you help us do that, right? And in many cases, you can even just do a listserv with your stakeholders, and people are very happy to help in my experience. So, maybe take just 5 minutes on this last page and write down the names of those organizations or people. And if you happen to know the name of a contact person there, go ahead and fill it in, because I think that's going to be the most crucial part of this checklist, is having the people on the ground, the boots on the ground that can help you distribute information. Because What you don't want to do is spin your wheels translating stuff super quickly and then not have it go anywhere, right? Not get it into the hands of people. So taking some time to identify your sources, taking your time to strategize and to start the process by having clear information and a clear plan will make execution much more efficient. You'll be able to get information out much more quickly. So even if it's a little bit of extra work up front, I think ultimately it does streamline things and make things a lot more fluid. So some people can be maybe religious leaders, business leaders, doctors, teachers, librarians, advocates, specific organizations, food banks, in-home social workers, service providers, anyone that has regular contact who's trusted. And before I move on to the next slide, while you're all brainstorming this, I think it's a good thing to add here that it's really important to develop your communication strategies in consultation with English learning communities, right? So I think that at the start, that means just getting it done and getting it done quickly. But then, using these relationships that you're building with critical communicators to circle back and get feedback, right? Like, information that's not culturally appropriate might be useless to somebody, right? And having somebody tell you that can help you stage a more appropriate response. And also, I think it helps that communities are included in policies and procedures that affect them directly because they know their communities better than anybody. And finding ways to maybe do surveys, listening sessions, virtual listening sessions, anything you can do to evaluate the effectiveness of what you're doing that gets input from the community, I think is really important. So now we're going to talk about the thing that Brittany brought up earlier, which is really important, which is actually translating materials with limited resources, with limited time. And that can be really hard. And so the first thing I would say would be to identify language service providers. So freelance translators, companies, citizen translators who you can train. And these should be people that you can rely on to translate quickly and accurately. If you do use citizen translators, make sure that they're trained and qualified. That trainer kit that I sent you, it's like 50 pages long, I think, and there's a lot of really great information in it. It's an emergency. You don't have to do the deepest dive into technique and stylistic things. You just want people to understand the ethics of accuracy and completeness, impartiality, confidentiality, et cetera, et cetera. So once you've done that, you want to talk to them about this idea that, hey, I'm going to get information from our health department at 8 a.m. I need you to translate it for me every day. Is that okay? How much is this going to cost? A great tool that language service providers might have versus freelancers would be translation memory software. And so CAT tools, which are computer-assisted translation tools, have a feature called translation memory, which basically captures translated materials and saves them as assets within the system so that anytime you translate something similar or something the same, it automatically populates. And so what can happen with translation memory is that a lot of this information is very, very similar. And so language service providers can give you a greatly reduced rate and also have a very fast turnaround time. Some freelancers do use CAT tools, but in my experience, finding small language service providers to work with who do use CAT tools can be one of the best ways to ensure that you're getting information translated really quickly. So that's one option. Some language service providers are doing blotters and little things for free. Ask around. It never hurts to ask. It never hurts to say, hey, are you willing to do this for us for the benefit of our community? And you'd be surprised that sometimes people would say yes. But you should avoid relying on ad hoc translation or interpreting. Remember to streamline things with deliberate partnerships, right? So you have your identified sources with whom you have agreements. You have your service providers, your translators, your interpreters with whom you have agreements. And then you have your community critical communicators with whom you have an agreement who are going to disseminate things. And if you get into a workflow of doing that on a daily or even a weekly basis, it can really change the landscape of understanding, and it can make things much quicker and much less overwhelming in the long run because you have more control and you're being more deliberate. Making sure that you do not impose this sort of work on people who are recruited for other positions within your organizations is important. So you don't want to like last minute say, hey, Karen from accounting, I know you speak Arabic. Yep. Can you come up here and translate this for me? Right? That's not ethical, and also they're not trained or qualified to be doing it. Unfortunately, you do have to be prepared to spend money on this, right? You can get people to do things free or at a reduced cost, but it does cost money in a lot of cases, especially because small businesses are struggling and translators are struggling. So you should plan to budget, figure out what it's going to cost. If you're using translation memory tools, that can really cut the cost down a lot. Or if you're using information that's almost the same every day, you can just have translators make changes to it as the numbers change and the figures change. But no matter what you do, just keep going back to this idea that accuracy is important. So you don't have to worry about punctuation, capitalization, spelling errors, things like that in a crisis. Honestly, I give you permission to not worry about that stuff. I know you don't need my permission, but sometimes it's good to hear that, you do want to make sure that the document is translated correctly, that it's comprehensible, that it uses the correct conventions for addresses and proper nouns, names, and you want to make sure that it takes cultural factors into consideration, that it conveys the appropriate register, right, like any good translation would. But it doesn't need to be proofread heavily if it's a qualified translator, right? You just want to scan for the big mistakes. And if there is a missing comma or a word order issue, I honestly just wouldn't even worry about it right now. And I know that that's flies in the face of best practices of, the industry, but in a situation of crisis, I think it's just important to get information out the door. So summing this up, working with your translation provider to do sort of an agreed upon same day plan is a strategy that's worked really well for us in Pittsburgh. Getting the translators the information from your primary source. Remember, narrow it down, usually your county health department or some other state official information. Get it as early as possible. They publicly do the updates on their web pages in my county at 11 a.m. So we get the updates at 9:30ish, and then we have them translated by noon because we already have established that workflow, right? It took a couple weeks to get it going and to make sure that people understood what needed to be done, but now it's working, and we have a great partnership with a lot of different stakeholders on the ground to make sure that we're doing like almost a bucket brigade to get that information out the door and into the hands of people who need it. So once we are able to distribute that information to our critical communicators, information usually flows through them by the end of the day or next day. And this really only works if you have those deliberate partnerships that you can form and execute on a daily basis. So I do want to be mindful of everybody's time since it's 3:57 and this is an hour long, but I'm happy to stay later if people have questions. If you don't have questions, then I would wrap this up by just saying that, you know, you want to make sure translation is a two-way street. It's not one-sided. Get that feedback from your communities. Keep ears on the ground with your critical communicators. Ask them how it's going. Get input whenever you can. And remember that trust hinges on what is being translated, by whom, in what language and format, and on the trustworthiness of the actors involved, right? So information is only as good as the messenger in situations like this. And finally, you know, for those communities in which literacy might be a challenge, you want to make sure that you're getting information out there in other mediums, you know, video, audio, TikTok, social media, anything you can to make sure that you're blasting out information in a medium in which people can understand. So take those worksheets, take some time to do them. It seems really basic, but going through the exercise, I think, really helps you to be able to break it down, right? And to think about who these people really are and to be strategic and to execute a plan. And I have this idea that leadership is just doing, right? Especially when there's so many moving pieces and things are hard. Just start where you are, put one foot in front of the other, and you're leading by doing that. And hopefully people within the organization and members of the community will follow. And if they don't, you know, having good policies in place, trying trial and error, making mistakes and learning from them, and including the community in your response, I think will greatly simplify the problem and save everybody time and money in the long run. There's also this great FEMA tips for effectively communicating with the whole community in disasters worksheet that I sent. These are all best case scenario things, right? Like in a perfect world, sure, we'd be able to just, you know, notify impacted LEP populations that language services are available. But, you know, the reality is that it's more complicated than that. So take the good with the bad. Do what you can with the tools that you have. And if you want to have a discussion or bounce things off of me, I'm always available to you on Thursdays from 3 to 4. So please don't hesitate to reach out. So does anybody have questions that they would like to go over before we end?
Yeah, this is Karen. One quick one. Are we going to get the PowerPoint from today like we have before?
Sure.
Okay, cool.
Absolutely.
And then
the video is going to be published also.
Yeah, if we can get the PowerPoint though, that's just easier for me than re-going through a video.
Sure.
So I have 2 questions. One's for you specifically, I think, Mary Jane, which is, what do you mean by train the volunteer translators? I mean, obviously, like, train them in what?
Sure. So I think a lot of people think that being bilingual automatically qualifies you to be a translator and an interpreter, but it's really a lot more complex than that. And people who are well-meaning bilingual, what we call citizen translators, will translate documents, but they don't understand the ethics and the technique and the importance of accuracy and completeness, of meaning for meaning, technique. You know, things like confidentiality are huge, impartiality, eliminating bias from your work. So really, you know, language services are, you know, a whole field and a whole profession in which most qualified and certified translators or interpreters go to school for 4+ years and then do ongoing certification.
Sure.
In order to, you know, be able to do their jobs well. And, you know, in some cases, the consequences of miscommunication can be like funny little mistakes, but they can also be life-threatening
Sure.
issues, right? So having people that at least are trained in the basics of what it means to be a translator and how to effectively translate and interpret is really important.
Well, I guess that was part of what I was thinking. Like, I'm not a translator myself, but I'm coordinating our translations. I don't think I would feel comfortable or nor do I think I'm the person that would need to train volunteers to do this. Like, I guess that's why I was wondering, but so aside from that, and this is, I guess, my question to the broader group, I know for us at the state, we're not able to use volunteer translators. We have to use certified translators for any information going up on our website. So we've had a number of people offer to volunteer, and we've directed them to nonprofits or other organizations that can use volunteers. But I know as the state of Michigan, if it's going on our website, we have to use a certified translator. So I don't know, Brittany or Lisa, and I'm not sure who else is on the phone because those are the only two names I saw pop up. I don't know about anybody else, you know, in terms of what your abilities are or are not when it comes to volunteer translators. I'd be curious to know or hear.
So this is Brittany. My health department would have no clue the difference. Like, they don't understand the difference between we call them language group advisors, which are kind of our bilingual helpers, and a translation company. I myself have said, if we have the time and we even pay for rush jobs, we should, prioritize translation and interpretation through the vendors that have trained interpreters and translators. But occasionally we have, like when the stay-at-home order got issued and we wanted to get something out literally within a couple of hours, we did use the language group advisors or the bilingual helpers. And the people that I've identified from the community, these are, first of all, they're like, their first language is this language, Spanish, Arabic, and Chinese. They're also from our partner organization, so they're also helping us get this information out to the community. There's a couple of people that have been trained as interpreters and translations in that group. So if I have a choice, if there's, I will go to them first among those groups to like translate something for me because I know that they've been trained in, so that's kind of how I've been handling it. Yeah, that's how I've been handling it. Trying to prioritize paid vendors who have trained translators and interpreters. Mm-hmm. Mainly because our emergency services and health department has no internal staff who are bilingual. So, yeah.
I would be happy to also put together a list of trainers who you might be able to employ to do some virtual training modules for people. Like I said, that training, the trainer document that I sent out has some great nuggets of information in it, but it's designed to do like a full 40-hour training. So I think, my suggestion would be that given the sort of, urgency of the situation, that you should go ahead and, advocate for using anybody that needs to be used. Sorry, I got distracted there because of the question aside.
But a big government like the state might say no.
And we can't.
So I actually have a additional follow-up question about this is, even though I'm not bilingual myself, I'm helping to coordinate translation, and knowing that this is very technical and this is a field, I'm kind of curious about, I think the answer is yes, that I should myself go through some of this training as well about.
I definitely recommend that, yeah.
Okay.
And I'm sorry, go ahead.
No, that was totally.
I definitely recommend going through some training yourself. Again, because we're in the middle of the crisis, if you have time, do as much as you can. But another thing that you can do to get around some of the red tape sometimes would be, if you have a reasonably skilled volunteer who has done, some translation in the past, but maybe isn't certified, you can have that person do an affidavit of translation or a sworn affidavit, just, declaring his or her fluency in the language and, certifying that it has been translated to the best of his or her knowledge and ability. And a lot of the times, just to have something like that on file can help you get around some of the red tape. But again, this is something that you should plan to pay for and have a budget for. And if that's the case, then I definitely recommend going with agencies. But have a contract, like I said, make sure that you're not getting charged crazy late fees, or rush fees rather, because I think there's a real opportunity for some like predatory behavior there. Hopefully you have some smaller local providers that you can count on in this time, because I found that they're the most willing to be flexible. People should absolutely be charging you less for repeats if translation memory software is being used. So for example, using an agency, if it's like, 500 words, but 350 of them are repeats from a translation memory, then they should only be charging you like maybe 20% for those words that are repeated.
Yeah. So
I'd never even knew to ask for that. So
so this is Karen.
Yeah.
This is Karen. We are using a local, when I say a local, I mean Michigan-based provider. I actually am pretty adamant that if we are going to pay for the translations, I want to keep it within the state and have, provide those fundings to state businesses, but or businesses employed within the state. But we have our translation company that we've been using has been really good about, if we have updates to documents, like existing documents that we've had translated, they only charge us for the words that they need to like the new words they need to translate.
Yeah, and that's where you're going to find some vendors will be flexible about that and some will not. Make sure that you have a contract with somebody who's willing to be flexible about that, because one, ethically, I think, right now in the world, we have to pull together and we have to be a team to address this problem. And if you're in the language services field, step up and do the right thing, right? And I understand that businesses are businesses, but if you have the choice, talk to people, talk to your providers, and if they're willing to not charge you for repeats with translation memories, or only bill you for updates to templates, that's a really good way to get through this, being able to use real providers, but not spending thousands and thousands of dollars on it.
On a single document, because I am spending thousands of dollars, but not on a single document.
Yeah. Keisha, did you have a question?
No, I wanted to add what we do at the county. Luckily, one of our border supervisors is a certified interpreter. So I utilize her a lot. For basic stuff like our closure signs, I do utilize staff that are have dual language is whatever. But for stuff that's being sent out to the county wide, like to residents, I definitely do use a service that's certified.
Mm-hmm.
Yeah. And in a lot of cases, if you do have bilingual staff members, you don't want to assume that they're going to do this job just because they're bilingual, right? They have to want to and agree to. But if somebody is willing and agreeing to help with translation, I think that putting $500 into training that person will save you a ton of money in the long run, right? So it feels like an upfront cost to have somebody go through like an online training or something like that that's costly. But like Brittany said, if you're spending thousands of dollars on translating documents, and you have a resource internally, you might as well use that resource. Ava, I see you have your hand up.
Yes, I just wanted to also share a little bit here in Louisville, in Kentucky, what we did, especially when we start with the emergency. We were able to identify and partner with our school system, because we have a newcomers academy here, so they do have some translation services. So we were able to partner very in the beginning with the general information and continue with some of their professors that they're teaching English and they're bilinguals in order to continue to volunteer on very easy projects. Most of the things that we have to be very careful to translate, or that is like very long text, we send this to our language services. We do pay for that service. But some of the really short things, like for instance, I think I heard somebody else saying like, oh, these things is gonna be closed, or since on starting this date, we're not gonna be able to upload that. Something like very short things. We were working with our volunteers, and some of them were from the school system that they are skilled to do that. So that can be also another source to find.
Yeah, and I think there's also something to be said for using machine translation plus post editing in a pinch, right? Not machine translation on its own, but we had talked during a webinar that I'm not sure, I think some of you were on the webinar 3 weeks ago, where we did talk about this, where, you know, using machine translation is not okay, but using machine translation and then having, you know, a qualified person post edit the machine translation to make sure that it's okay is also a lot cheaper than doing translation from scratch, depending on how bad the machine translation is, right? So this really only works for the big languages, Spanish, Chinese, Arabic, Russian, because the machine translation systems are better for those language pairs.
Yeah.
But that's also, you know, a thing you can do. And again, like, there are best practices for language access. And then there's COVID-19. And there's no playbook, right? There's nothing to compare this to. There's no precedent, right? Because we haven't done this before. And so my opinion as somebody who does language access is that you have to do the ethical thing and the right thing, and you have to make sure information is accurate and complete. But whatever you have to do to get from A to B, you know, get creative, use the tools that you have, and it's okay to make mistakes, right? It's okay to try something and have it fail. It's okay to do your best and find that something else would work better, or, you know, to try to do something new and have it not work out, right? You know, this is unprecedented and it's not something that has a clear answer. So, you know, my advice is to just do your best, make sure you stick to these basic principles, make sure that you're putting effort into this, make sure you're including the communities that you're working in, and it's a conversation, right? I mean, there's not a whole lot we can do in 1 hour every week in terms of, like, you know, information that somebody might not already know, or like solving the problem of language access. But, you know, if we are getting together every week, we can learn from each other and we can come up with new ideas. And I think that there's real power in that, because we all come from different backgrounds. We all have different levels of experience. And so those of us with maybe less experience in language access can maybe pose questions that those of us who have a lot of experience wouldn't have thought of, and give us a chance to address that and to think about how that can affect a good response. So I really appreciate all of your input, and I'm glad you're asking questions, and I'm glad that you are engaged, and you are all welcome to reach out to me anytime. And Ava, I still see your hand up in the thing, or was that just from before? Okay, I'm gonna assume that was,
Yeah.
oh, okay.
Yeah, sorry, I just forgot to take it off.
Okay, all right, just making sure. Does anybody else have any questions or anything to add? Okay.
I do.
I'm sorry? Yeah.
I do. So I have a question about, so versus doing the 40-hour interpretation and translation training, you said that you're going to send out some resources that are shorter that might be other viable options for us to either train other people or to train ourselves. Is that correct?
I can certainly do that.
Okay.
And would you all be interested in doing one of these sessions about training?
Yes. Yeah, maybe it's a matter of just us getting a sense of, I just need to know what to look for when I go to my vendor and I say, can you do X? Or or, you know, I hear about an organization from you that maybe is a better option. But
yeah, that's great feedback, because you'll know we only have, so basically our strategy for these workshops is we have the first 4 planned and written out, but we wanted to wait to see the feedback from them to kind of work out the remaining ones. And so we can definitely do an hour on training resources,
Perfect.
things to look
Could
out
we
for.
Could we do
Yeah.
it sooner? Only because Welcoming America has this grant application that can fund things like this.
Oh, so did you say sooner? Was that your question?
Yeah, so that new rapid response grant thing, I don't know if anyone's looked at the summary yet, but I don't know when it's due. It's due in a couple of weeks. So, and it says that it can pay for language access, like translation of documents, but I would be more interested in paying for people to be trained.
That's a unique approach, yeah.
So whether like both community, like bilingual helpers or some of our staff, so we can be cross-trained and not rely solely on me or, and I'm untrained. So,
Yeah. I think that's a fantastic idea. And I will talk to the folks at Welcoming America to see if it's okay to bump that up in the curriculum a little bit.
Would other people be okay with that? I don't want to.
Yeah.
Okay. I don't want to assume that that's what everyone else wants. So.
Yeah, and honestly, you guys can reach out to me, email me anytime with other suggestions too.
Okay. And then I do have one more question. So
Sure.
what I'm hearing from some of the presentation that you had was that you guys are doing kind of 2 lanes of work in your local community for translations. One are these daily, you're translating whatever these bulletins or these updates are on a daily basis. But you are doing the translation of documents, or your health department is doing the translation of documents?
So we're the service provider. We're the agency that does the translation. The health department requests the translations from us. And then the health department has the partnerships in the community.
Okay.
Yeah. So we don't do direct. Yeah, we're a vendor. We're a translation vendor. And we have a program called the Language Access Project. So we do it for free. Anything that's health and safety related, like to COVID-19, we just do for free. And that includes like the city's press releases and things like that. So that's like an example of a community partnership with one of your local translation vendors. We're just we're in the middle.
Are you translating press releases?
We are, yeah, for our city.
Wow.
Yeah, not all of them, but the ones that are relevant.
So you are still pushing out daily information to the community then in translators because, okay. I mean, it seemed like at the beginning of this crisis, we were doing that.
It's easy to run out of steam, yeah.
It slowed down a ton, and honestly, I don't know. I'm concerned about the non-health related emergency information that should be going out, because now that the health emergency is it's still happening, but people they tend to know like, oh, I'm supposed to wear a mask. Oh, I'm supposed to, at least we assume that people know that information. It's the non-health emergency that I'm a little concerned we're not.
Yeah, and that's the kind of stuff that we're doing. Like for example, the governor's reopening plans, right? Yeah. People need to know that stuff, right? And so the county so our county has an Immigrants and Internationals Advisory Council. And so that's part of it. That council prioritizes things like that and gets them to us for translation.
So they do it for the health department?
Well, the Department of Human Services and the health department both send us information to be translated. I kind of lump them together as just the county, broadly, but they're coming from, the same entity, I guess.
Have other people, if other people are on the call, have other people had their local like reopening plans translated, like businesses or organizations?
Hey, Brittany, it's Karen. We will be translating the state's information and in terms of reopening, whether it's a press release or an executive order or whatever that might be. The issue that we have and I've already asked about this and have been basically the door was shut in my face, so to speak, is that we don't get information before it's released, and we cannot get information before it's released. So we are translating after the fact, and there's nothing I can do about that.
Yeah.
And some things we get back some same day, and sometimes we don't get things back for, 24 to 48 hours.
Well, that's
My
fair. I
problem-
don't know if you can, go
My
ahead.
problem is our health department created a 14-page document and haven't asked me to coordinate translation. And I'm guessing because they created a 14-page document.
So the other thing I'm trying to do, Brittany, and I don't know if you all are able to do something locally there. The other thing I'm trying to do with the state is put a process in place to have those longer documents. And actually, I'll be the one putting them into a shorter, like 1 to 2 page overview.
Bridge 'em.
Yeah, I've been starting to, I initially was translating all of our executive orders, and at the end of the day, I looked at them like, this is ridiculous.
This is
because
insane.
No one's going to read the legal authority, or no one cares about the legal authority for the governor as why she can do this. They just care about how it affects them. So I've been trying to pare down some of the executive orders into like 1 or 2 page overviews.
Yep.
But I'm the one that has to do that. The governor's office won't do it for us. So now we're just trying to get a process in place to get it approved.
This is just a mess.
It is a mess. And I think I always go back to this idea of simplifying. Like you said, we don't need to be doing executive orders right now. We just need to get the relevant information that's, has to do with people's livelihoods and jobs and health and safety. Businesses, right? Prioritizing and streamlining. It's hard because, who are we to decide what information is vital and what information is not for community, right? And that's where the listening part is so important with regard to feedback from the community. But in the meantime, go ahead.
I say, but I feel like that's part of what we are being asked to do.
Yeah.
Oh, well, of course, because they want something simple. They want it just tell me what I have to do so I can check a box.
Yeah. So they can check the box. That's exactly right. But there's a way to do it meaningfully, and I think I always go back to this idea that we also have to be kind to ourselves, right? Mental health is important for us too. And as long as you're doing your best, then you're on the right path, right? There are going to be bumps, and you might beat yourself up sometime because you missed something, or you don't have the resource to translate something that you think is really important. But as long as you keep pushing and keep fighting, and remember that it is a social justice issue and that you're on the right side of things, you're doing your best. And, that's not to say that you should be like, whatever about it. But, like I said, there's no playbook for this, and we're writing the playbook. And so, give yourself some slack. And I think as humans, we're really good at blaming ourselves when things go wrong, but we're not really good at accepting praise when we do things well. So I think you guys should all give yourself a round of applause for being the voice that's pushing this within your communities, because language access is something that is kind of an afterthought, I think, for a lot of people. Most people don't understand language access or understand that it's a problem or even get why it's needed at all. So you guys are way ahead of the curve, and you're fighting a good fight. And, I appreciate all of you, and you should definitely be proud of yourselves just try not to beat yourselves up.
I appreciate hearing that. So,
Sure.
Okay. Well, thank you.
Thanks so much.
Yeah, it's a pleasure. I hope to see you all soon. And let me know if you guys ever need resources or information.
Well, thank you for sending out some information about training, and then maybe even bumping up that as a conversation point. So
Sure. Yeah, I think that's a great idea.
Okay.
Thank you.
All right. Yeah, bye everyone.
Bye.
Yeah.